Achondroplasia is the most common form of dwarfism, which accounts for 70% of all the cases. It is a congenital defect that affects roughly 1 out of every 26,000 to 40,000 newborns. The word achondroplasia means without cartilage formation. Cartilage is a tough but flexible tissue. Much of a person's cartilage is transformed into harder bones by the time they reach childhood. However, in achondroplasia, the problem is not with the formation of cartilage, but rather with the conversion of cartilage to bone, a process known as ossification, which occurs most commonly in the long bones of arms and legs. Now let us talk about the characteristic features of achondroplasia. People with achondroplasia generally have normal intelligence levels. Their symptoms are physical, not mental. A person with this condition will likely have a short stature. The average height of an adult male with achondroplasia is 131 cm or 4 feet 4 inches. And the average height for adult females is 124 cm or 4 feet 1 inch. Achondroplasia patients have an average sized trunk. Their arms and legs are short, especially the upper arms and thighs, in comparison to the body height. They also have short fingers in the hands and feet. They have a disproportionately large head compared to the body with a prominent forehead. Causes: achondroplasia is caused by mutation in the FGFR3 gene. The FGFR3 gene provides instruction for making a protein that is involved in the development and maintenance of bone and brain tissue. Transmission of the disease. Achondroplasia is inherited in an autosomal dominant pattern, which means one copy of the altered gene in each cell is sufficient to cause the disorder. Around 80% of people with achondroplasia have normal-sized parents. These cases are caused by new mutation in the FGFR3 gene. In the remaining cases, people with achondroplasia have inherited an altered FGFR3 gene from one or two affected parents. Individuals who have two altered copies of this gene have a severe form of achondroplasia, which causes extreme shortening of the bone and an underdeveloped rib cage. These individuals usually born dead or die from respiratory failure shortly after birth. Treatment. As achondroplasia is a genetic disorder, so no treatment is available.